I want to talk about data a little bit. And when you look at a startup, when you look at a company you're thinking about investing in, does it cause you concern when they say, well, we're going to get access to the health system data or to the healthcare delivery organization data? Is that still a significant barrier? And you say, well, okay, how are you going to get that data? Do you know how you're going to get that data? There's multiple EHRs, there's multiple, I mean, does that cause you concern, or are we moving beyond the interoperability challenge for startups?
Well, Bill, let me put the question back to you because don't think that many of the listeners will understand that this isn't just about the EHR. So, how many different systems did you have collecting patient data other than the electronic health record? How many
Oh, yeah.
systems would you guess?
Oh, hundreds. I mean, yeah, hundreds and multiple instances of that. Just Allscripts alone, we had multiple instances of Allscripts, for heaven's sake. Yeah, we identified over a couple hundred systems that had a field in it called patient name, patient first name, patient last name. And I thought, that's interesting in and of itself. Wouldn't you want them all to share that same single thing? Well, that's why I asked the question, because it seems to me that the startup has to make a decision. Do I really need this data? And if I don't need this data, I'm probably in a better position than if I do need this data, because now I have to delve into that world of, is this clean data? What am I looking at? Am I getting it from the right systems? Do I have to go through all the hoops that you have to go through to get access to that data and then provide the security, especially with security the way it is today? I would imagine those steps have even gotten harder to get through for these startups.
So, the reason why I raise this is because when you think about pharmacy management systems, lab information systems, surgical information systems, supply related systems, there's a vast number of systems that sit inside the walls of a given hospital, maybe less so in a provider office, but even there may be multiple systems. You don't necessarily always have a unified scheduling and billing system to the electronic health record. That's gotten better. So, is it easier to access data today than it was when we met on our panel 5+ years ago? Yes. But in many respects, you still have to understand what you're going to do with that data and what's the currency of the data and how important is it to your offering when you're making that decision as an early stage company. I think the next real challenge is not around the data, but what you do with that data. How do you interpret it? What are you learning from the data? And how can you act on it? And to do that, as you said, in a secure way, because having lots of open endpoints is not going to happen in an environment that is now fraught with ransomware and other huge challenges to healthcare organizations. I think it's going to be harder to access data going into 2022 than it was coming into 2021.